You're listening to the Health and Wellness Podcast, curated by Dr. Lori Marzell. Dr. Marzell is a primary care physician and a certified menopause practitioner that combines the wisdom of natural medicine with modern medicine to help maintain optimal health. She has a special focus in food allergies and bioidentical hormone replacement. Thank you so much for being here. Enjoy the show.
Hi, this is Dr. Marzell. Today I'd like to talk about a particularly favorite vitamin, B6. Do you need more B6? Many of us are in dire need of B6 and just don't get enough. What is so special about this vitamin? For those who remember your days in high school, discussing all the different chemical reactions in your body, B6 was there. As a matter of fact, it's a cofactor in almost every chemical reaction in your body. Let's look at some specific functions. Carpal tunnel syndrome. B6 helps prevent this, an unfortunate result of excess work on keyboards. B6 helps repair inflamed nerve tissue and decrease the swelling that presses on the nerves, causing damage, tingling, pain, and numbness to begin with. Therapy for this particular problem requires up to 12 weeks or so, dependent on the individual situation. But this frequently works. And if it works, you don't need to have surgery. How nice. B6 is important in arthritis. Dr. Ellis, a medical doctor who noted nutritional therapy with his patients, found a type of arthritis occurring around menopause that manifested with swollen fingers and tender joints. He found that this particular arthritis responded to doses of B6. Diabetes, B6 helps decrease blood sugar and prevents the deposition of sugar in tissues. If sugar is deposited, tissues will actually become stiff and achy. How about in asthma? Many studies have shown a decrease in asthma attacks in people who take extra B6. And for those of you who have or know people who are predisposed to have kidney stones, B6 and magnesium work together to help prevent stone formation to begin with. Nausea in pregnancy. This can be prevented and treated with B6. There is a condition called homocystinemia. What that means is that you have a particular protein in excess floating around in your blood, homocysteine. Homocysteine is not a very nice guy. It likes to clog up your arteries and cause plaque formation. B6 and B12 and folic acid will help reduce this condition naturally and therefore prevent further buildup of plaque in your arteries. Do you need more B6? Well, some folks have difficulty converting this vitamin to its active form. B6 is called, in the basic form, is called pyridoxine. But it must be activated to be used. So pyridoxine has to be hooked on to a phosphate group. This produces pyridoxal 5-phosphate. This is the converted and active form of the B6. I like to use this converted form because it's hard to tell if people are able to convert this on their own. It's not that expensive, and we know it immediately works. Do you have a B6 deficiency? How can you tell? There's actually some little things you can do to figure this out. Do you recall your dreams? If you have trouble remembering them, you're probably B6 deficient. Interestingly, people, as they start renourishing their body by providing B6, will notice that the dream memory starts coming back. You can also tell with some physical signs. If you curl up your fingers such that they will touch the crease between your fingers and your hand, this is a really important test for which includes B6. Other things can cause this, but a B6 deficiency causes swelling. And if you are unable to curl that around to touch that particular crease, you may very well be deficient in vitamin B6. If you recall when you were going to school and all these chemical reactions that you had to learn about, B6 was a cofactor in probably most of them. It is a very, very important vitamin. It's also involved in nerve damage. If you have damaged nerves, B6 may help with that. So let's all yell a shout of gratitude for B6. And if you have some of these symptoms or know someone who does, maybe get them to try a little B6. It's water soluble, so it should not be toxic or have any bad effects in your body. If it's not needed, it will be eliminated. Thanks for listening, and stay tuned for more fascinating little commentaries.
Thank you so much for listening. If you learned something, don't forget to share with a friend. You can visit us at www.drmarzell.com. We create content for you. If there's a subject we have not discussed or a topic you want to dive deeper into, let us know how we can empower you. Questions can be submitted on our website under the podcast page. Until next time.